Hi, I'm Dr. DeFabio, and it's a great day to talk about diabetes, specifically type 2 diabetes. It's Diabetes Awareness Month, and that's our mission, is to help people who have blood sugar metabolism issues understand what they can do naturally with lifestyle intervention to, number one, reduce pre-diabetes syndrome, and to also manage that type 2 diabetes, which is delayed onset or often diet related. So how are we going to do that? Well, first of all, if you are diabetic, I don't care if you're 1 or 2, and if you're going to do any of the interventions I'm going to talk about, be careful. Don't crash your blood sugar. Watch your blood sugar carefully, maybe talk to your doc about them. But you need to keep an eye on that blood sugar level if you're on medication for it. So what we're going to talk about today will help lower your blood sugar, and I'm going to explain why. But don't just dive in 110%, go all in, and crash your blood sugar and then run into an issue. Because a blood sugar that's too low, as you know, is just as bad as a blood sugar that's too high. In fact, too low is probably even worse. If we had to pick one, we'd rather have it too high. It's easier to bring it down. But anyway, what do we know? We know that cardiovascular exercise, walking, running, treadmill, elliptical, cardiovascular exercise will increase the efficiency of insulin up to 3 times, right? Your pancreas secretes insulin to metabolize carbohydrates. So if you do cardiovascular exercise, your insulin efficiency, its ability to burn up those sugar and carbohydrate molecules, can be increased up to 3 times. So get out there, walk, ride a bike, do an upper body bike, do an elliptical, do a rowing machine, swim, something. Get some cardiovascular exercise. Minimum 30 minutes a day is where you want to be, okay? Does it have to be real hard? No. Does it have to be consistent? That is preferred. Moderate level's fine. You want to do little bursts where you go a little bit harder if you can physically handle that, and your joints or your cardiovascular system, a great choice. So get some cardio in. The next thing is we need to look at your macronutrients. You have protein, you have carbohydrate, and you have fat. Those are your macronutrients. They all get digested and broken down into your body and absorbed and converted for energy into a carbohydrate, into sugar, into glucose. No matter what you eat or consume, to give you energy, it gets converted to a sugar, a carbohydrate, a glucose. You eat a lot of sugar, that conversion's easy. You don't eat a lot of carbohydrates, and that conversion takes a lot more time and a lot more energy. The more sugar in your diet, the more carbohydrate load in your diet, the more insulin your body has to either produce or take in from an external source to metabolize it, all right? So that's what your medications do. So how do you take less medication? Eat less carbohydrate. It is that simple. With my pre-diabetic patients who aren't on medication, I'll tell them right out of the box, no more than 100 grams of total carbohydrate a day. Sometimes we'll even get them to 80 grams of carbohydrate a day, all right? And they're not on medication. I don't have to worry about them having a reaction to their real low blood sugar because they're taking medication. If you're on your medication, first thing you do is do a diet diary for a week. Find out approximately how many grams of total carbohydrate, that's from any sources, are in your diet. Once you know what that number is, slowly decrease it by 10% a week with the goal of getting it down to 100 grams a day of total carbohydrate load. At the same time, you have to watch your medication to make sure that that's balanced, all right? That'll prevent you from crashing. Going right to a high protein, high fat diet, if you're on a diabetic medication, is not a good choice. I do not recommend that. So watch your carbohydrate load, get some cardio in. Those are 2 really, really important things you can do to reduce your risk for getting diabetes or becoming a diabetic if you're pre-diabetic. And if you are a type 2 diabetic, those are simple lifestyle choices you can add to help reduce the amount of medication you need to manage your carbohydrate load. And then if you wanted to look at supplements, we know that chromium picolinate is very good at help metabolizing sugars. Nutritional yeast can be very good at stimulating the metabolism as well. So there are things you can do to help augment that from a nutritional perspective. Brown algae, there's lots of things out there. But the bottom line is you don't want a lot of carbohydrate load, a lot of sugars in your diet in the first place. I'm Dr. DeFabio. It's been a great day to talk lifestyle change and empower you to eat right and to live healthy. Have a great day.